morning. Good morning.
Good
and
morning.
welcome to Brentwood Beauty Buzz. Hi everybody, how are you? Welcome
Hello.
again. It's Thursday morning. It's a little after 10:30. We're a little tad late, but we're here. Good morning, ladies.
Good morning.
Good morning.
How are you?
We're good.
Yeah?
Very good.
Good.
I accidentally scratched my nose and I had a little pimple, but I am great.
But I can't
That's
see
why
it.
we were late.
I can't.
Yeah,
That's why we were
it's
late.
red. I hope it just. It's okay. One of these products will cover it.
That's right.
Lucy stole my look.
I did. I stole her lipstick.
Cute. And I stole your powder. So today's show.
Oh, I should give some to you.
Today's show is all about skin. We had a good time last week when it was all about the eyes. Today it's all about skin care, skin treatments, getting that beautiful glowing complexion. So we have a few before and afters, and we've got some acneic treatments. But first of all, my name is Caroline. I'm the practice manager here, and this is Dr. Iman.
Hello.
Hi.
Lucy. Lucy B, Lucy Dash.
I'm the physician assistant here.
She's the physician's assistant here. And Maya
Z.
Maya Z. Maya Z is our medical esthetician. Been with Dr. Lee for 20 years, and now with advanced skin care. It's coming up on a year. Isn't it?
In October.
Yeah, in October. So this is advanced skin care in the heart of Brentwood. And we decided to have this little show called Brentwood Beauty Buzz. We wanted to come to you and share what we do here, and hopefully you have questions. Please write them in. We'll answer them on air or after we get off with the show, and we'll let you know what we offer here. So what do you want to start with? Should we see what's first on the screen?
Yeah,
Sure.
Why not?
Let's.
Imagine it's my face.
Just jump around.
Oh, thank God it's
there
not
we
my
go.
face.
Okay, so
This is a good one.
I guess today we're just talking about anything skin.
Yes.
Acne, hyperpigmentation. This girl specifically had a lot of sun damage plus acne, and she came in like begging for help. And with a series of chemical peels spread about a month apart, and then a couple dermaplaning sessions, we were able to like get her skin under great control, get it clear, put her on a regimen, and of course the regimen includes all the diet that we spoke about a couple weeks ago. But
That's amazing.
that
That
was
is pretty
she
amazing.
was so
Isn't it?
happy.
That's pretty amazing.
I would
So
be
happy.
happy too.
Yeah.
I mean, a lot of it was just sun damage that needed to be dermaplaned off, but you could see that she had underlying acne, and it needed to be treated from an underlying standpoint as well.
So
Yeah.
what did you do here exactly?
Well, we did chemical peels
Yep.
regularly. And then when she was flaky, like that day specifically, I believe this was a while ago, but I dermaplaned her. I can show what dermaplaning is at some point. We can dedicate a show to that
Yeah.
because it's really cool. You use a blade and you're basically scraping the skin.
By a very good professional.
Yes, I don't
Anytime a
recommend-
blade comes close to your skin.
They make them at Sephora where you can buy them, but it's not the same. It's not the
No.
same at all.
No.
This is surgical one. It's very thorough, very fine,
Yes.
very delicate.
Specific
exfoliation.
angle that you have to use, and how many passes. You can't just wing it. You can cut yourself. I've cut myself.
Oh my God,
I've
yes.
cut patients. I mean, it's not.
That might not be a good thing to say.
Well,
Yeah.
I mean,
I mean,
And we'll say this
what I did.
again.
I
You should be under the care of a
No, we know what
professional.
you
Yeah.
Absolutely.
But like, as a physician assistant, I had dermaplaning, correct? Maybe 3 times, and my first time was just 6 months ago. I do wash my face and exfoliate every day, just to let everybody know. But the amount of grease that came out, the layers of skin, I was
It's amazing.
I
isn't
was
it?
amazed.
Did you do it yourself?
No.
No,
I helped.
she
It's
she
like
helped
I
me
said, it's a
guide,
very thorough
guide.
exfoliation.
but
very detailed.
it was a game changer for me. My makeup went on nicely. actually
products go in easier.
products and treatments. Laser treatments, I mean, if you don't dermaplane and take off that dead layer, oops, sorry, my bad. My bad.
We're live.
Anyway, we're live, but it's okay. I'm sorry, my bad. Anyway, this is a fabulous product to put on afterwards. It's called Dermal Repair. I just saved the show. I'm sorry. Anyway, if you don't take off that layer of skin, the laser is not going to penetrate deep enough to address those issues and concerns, whether it's acne, sun damage, wrinkles.
Yeah.
I mean, anything.
Yeah. I love it.
But
I love
chemical
it.
pills, I mean, that's amazing, Dr.
I love it because it
Thank
helps
you,
with-
Sean.
Thank you.
IT extraordinaire.
I love it because it helps penetrate the products
Yes.
deeper. It doesn't lay, especially serums will
Right.
you benefit. You will see results faster
Right.
when your skin is nice and clean and super
Yeah.
exfoliated. And yeah, so all of those before Lucy knocked them down.
This
will
is a
work.
quarter of my bathroom.
And
I don't know about you.
this
It's got to be
daily
like
routine.
nothing in your bathroom.
This is daily routine. No. I'm gonna tell. Steps. It takes a little.
Don't be scared.
Don't be scary. It doesn't take that much.
I wanted to ask Lucy, sometimes you microneedle when you do Clear and Brilliant, which we'll talk about, but would you consider dermaplaning before Clear and Brilliant?
Of course.
Okay.
Ideally, this is like a best case scenario. They get a facial, they get dermaplaning, and then doing Clear and Brilliant, and then using these amazing products afterwards. That's an ideal scenario. Sometimes patients don't have the time to do a facial and all of that, and it kind of cuts the treatment. That doesn't mean they still didn't get a great result, but in terms of penetration and depth, it's very good. I mean, personally, notice patients getting better results, and especially with acne, when they dermaplane before a treatment.
Yeah,
Whether
because this is.
I mean,
it changed her life.
yeah.
This
Yes,
could
it did.
change, and that's what's so gratifying too, isn't
And
it,
it's
for
so
you guys?
simple. Yes, it's such a simple procedure, but
Yeah.
it changes people's lives.
And we have different patients' needs.
Yes.
Lucy's cousin came.
Yes.
She needed dermaplaning, facials, hair removal, dermaplaning.
Yes.
So it's a different approach for everybody. Allison, she had an amazing result. We
Her
saw it
skin
as a
is like day and night.
flawless,
It's
yes.
flawless now.
Yeah.
I'd love to see that photo. You should have that.
I should have it
Next
before and
time, let's
after.
do an
I'll
after.
definitely
Yeah.
ask her.
Because
I
that
mean,
would be
Because
really
her
cool
issue
to
was
see.
acne coming from the hair follicle. So
Yeah.
the laser hair removal was a must. And along with the products and the dermaplaning.
And a lot of women suffer from that under the
Yeah.
chin. It's a hormonal thing,
It
isn't it?
is. It is.
Do you feel that laser hair removal on the face and neck on women who have hormonal issues, does it help them?
It helps them. It does help reduce the hair. Now, everybody says you need 6 to 8 treatments. That's not true. You do need to continue treatments for life. Granted, it's not going to be monthly. It may be 3-4 times a year. It will help suppress the hair follicle, reduce it about 80 to 90%. And the regrowth is very fine, so the upkeep is less, so it's affordable at the end of the day.
And for the blonde ladies out there,
Dermaplaning.
redheads, does that?
Yeah,
Dermaplaning.
dermaplaning.
It doesn't make the hair come back thicker in any way.
No.
And I do tell the women who do complain that laser hair removal, which I'm not trying to say don't do it, but if it's not for you,
Yeah.
dermaplaning would be for you. Granted, you'd take the not related to diet going on, you get it checked by your woman's health doctor, and that's what'll at the end of the day fix it from the root.
I have a friend that plucks like crazy.
Oh,
she has that
that's the
magnifying mirror, and I
worst.
tell her
Those
not
are the worst.
to
That's
do
the
it.
worst.
And then she gets little bumps.
Of course.
There are a lot of women that do that. I know there are. I know you're out there. And too afraid to ask. What should they do if they cannot stop doing it? Because it really is like a habit. It's like an obsession.
It is.
What can they do? Maybe put salicylic. What do they do to help that bump, those bumps that I see it on my
the
friend?
irritation.
Yeah.
It's good.
They have
If
to
they
get rid
don't
of the
stop-
follicle.
Yeah.
They need to. That's
Okay,
it.
so
They
there's
can
nothing.
do a dermaplane prior to a laser hair removal treatment, but if they pluck the follicle, I mean, laser is not going to work. So I stress.
Because why?
Because, I mean, there is no root. The target, the laser targets the follicle, the root itself. If you pluck the hair out, there is nothing to address. So you're going to come in and get a treatment, pay, and get no results. Also, the hair grows in stages. So once you pluck the hair out, you're interrupting the hair growth cycle. So that also interferes with results. And patients come to me, they're like, well, I'm not getting any results. I'm like, are you plucking? Yeah, a little bit here and there. And I'm like, well, that's going to interfere with your hair growth cycles. So trimming, if they don't want to shave, dermaplane. Dermaplaning is great. You do that in between sessions, and that will at least help not only your skin, but also help reduce the appearance of the hair itself.
I call it professional lady shaving.
Professional
because
lady
basically
shaving.
that's what you're doing. You're shaving your face,
Yeah.
but nobody wants to say they're going to get their face shaved. I'm dermaplaning. I think it's brilliant. To tell
I
you the
think it
truth.
is brilliant.
Right? It's a brilliant idea.
It is.
It's changed
Okay.
my whole regimen.
Yeah.
Same. We
That's
all,
good.
we all
pretty amazing.
use it.
Yeah.
In fact,
We
I
all
need-
shave
I
our
need it.
face.
I need it.
Pretty much.
Yeah.
Men and women.
Dermaplane.
If whoever's watching on mine, if you want to see an example of dermaplaning, scroll down on my page. You'll see a video. Sorry, I forgot to send it to Sean, but
okay.
it's on my page. You guys will see it.
And what is your page?
Dr. Iman Abdallah.
Here we go. We're going to go to the next photo for skin.
Oh, and that's me.
Oh, no, Lucy.
Oh boy, that's straight out of bed with no makeup. Okay.
Last night's makeup.
Yes, that was
this one's
actually
after.
that was right before the treatment. I had washed my face, and this was before a Clear and Brilliant. You can tell I have hormonal breakouts. Unfortunately, I mean, all we can do is really control our diet and do treatments and dermaplane, cleanse the skin, and exfoliate as much as possible to regulate the oil production. But a great way of suppressing acne breakouts is doing a Clear and Brilliant treatment.
That's right here.
That machine right there.
Do you want to?
It's pretty amazing.
Multifunction.
This machine, we have the original handpiece on, and this one actually helps minimize pores. It's like a gentle exfoliation. It creates micro channels in the skin, and what you do is you actually roll the machine on the skin, and that's how it creates the little microscopic injuries. And those injuries, eventually the healthy skin heals itself and forms new collagen, and so the acne scars improve, your pores, fine lines, and texture improves. And also it helps regulate some of the oil production on the face. So incorporating this, maybe doing it every 3 months or so. If you have severe issues, do it monthly. About 3 to 6 treatments is ideal. And then seeing Dr. Iman. If you have like hormonal issues, it's great to address. Let's say if it's your diet, or even if you're eating cashews out of the norm, which I just found out that it actually causes breakouts and inflammation. So I always mention cashews to everybody.
Yeah.
So
this is so well named. Clear and Brilliant,
Brilliant.
because it really gives you a clear and brilliant complexion.
It does, and that's actually 1 week after the treatment.
Yeah.
And
you're how are you the next day? How are you the day of?
the day of, you feel like you have a mild sunburn. For a good hour, your face is on fire, you want the AC on, you're like blowing cold air, you want to ice your face, but after an hour it goes away. The injuries that are formed basically the skin dries. It gets kind of like a coffee ground.
Yep.
And it turns flaky, and that's all the dead skin slowly sloughing off.
And
So
this is one use only. This tip
Oh yeah,
comes
these
off,
are disposable. Yes.
and you throw that away.
Yes, we throw
So
it
it's just
for
for-
each patient.
Mhm.
So it's a clean head, sterile head for each patient. So afterwards, you just have dry skin. You can wear makeup the next day. It's a superficial laser. People don't want to be indoors for days after.
Right.
So it's a
And wear your sunblock.
Oh yes, I forgot about that. Amazing sunblock. You need to protect your skin afterwards because you are more susceptible of sun damage or just discoloration in general. Any skin type can do this treatment, 1 through 6, with little downtime. It's called a lunchtime laser or facial.
Yeah.
So
can we talk about the skin types?
Yeah.
So people know, like different. You know, if you're Hispanic, you're most likely 3, 4, sometimes a 5.
Yeah, I mean it ranges. It definitely ranges. Caucasians are from 1 to 2. If you tan, you're considered a 3. If you don't tan, you're considered a 1 to 2.
Can this be used on everybody?
Everybody. As long as you don't have a recent sunburn or you haven't been to the beach in the past 2 weeks, you can do the treatment.
What will happen if you've been to the sun?
Pigmentation.
Okay, because people don't like to tell the truth, and they want their treatment, and they'll say, "Oh no, I haven't been in the sun." Do you tell them if you suspect they have a suntan? What will happen?
I do. I tell them you're susceptible of developing post-inflammatory hyperpigmentation, and it can take months to resolve.
What does that mean for the people at home that don't know what hyperpigmentation is?
Hyperpigmentation is darkening of the skin in the area. So your spots, you can
blotchiness.
As a result of inflammation.
Yeah.
So tell the truth when you go to see your providers.
Yes, please. Even sunblock is still considered sun exposure if you're around the pool or at the beach, because UVAs and UVB still and free radicals travel through sunblock.
True.
So,
what's your one thing for skin to prevent aging, to prevent early wrinkling? What is the one thing people could start doing right now?
What is that, Maya? Tell them.
SPF.
SPF.
There you go. I gave my teenage daughter at age 14. I told her, this is your best anti-aging tool that you're going to have. It's your SPF. You can, obviously, we take care of our babies when they're little, but we forget somewhere. I'll tell our teenagers and daughter sons to start on their SPF.
Yeah.
If you never get a severe sunburn, you won't prematurely age.
Right. What about you, Dr. Imam? What do you think?
Does it have to be a
No. It can be anything, because the skin is the largest
honestly,
organ on the body, so.
Getting a good night's sleep.
Okay.
If you get your 8 hours, you feel refreshed, and then you're automatically decreasing the stress that you would normally get if you didn't get a good night's sleep. And that stress is what makes your skin look bad.
That makes a lot of sense. What do you think?
Water.
Oh, yeah.
Hydration.
Yeah, drink my water.
As I said,
You mean that's not coffee?
no, it's water.
It's water.
I
Where's
pretend
the
it's
coffee? Hey, how come I got water?
But ladies, we forgot to mention.
No, we're coming down to you. We're coming down to you.
So if you haven't gotten a good night's sleep,
No.
You can get an oxygen facial. There you go. You're hydrated and you're slept.
I meant to say after the tingling and discomfort of any of our treatments that are very helpful, but they can be irritated for a little bit. We have an option for you afterwards, after microneedling, after a clear and brilliant Flaxol, what have you. We have the soothing, cooling oxygen treatment.
This is a wonderful device.
Wonderful, yes. And it has this.
It's just brand new in our office.
Yes. Brilliant.
how does it work?
It's not on.
Yeah.
Push this button. You press this button, place this dump over a patient entire face, so it's much more thorough.
And it just shoots out oxygen?
No, just mist.
Yeah.
A gentle mist into all
Is it
over
at
the
a
skin.
different percentage?
Yes. There's a different
Yeah.
for
Okay.
I fall asleep.
It's very
It's
relaxing.
so wonderful. Yeah.
Is it almost like those hyperbaric chambers that you can go and lay in?
No,
No.
because that's pressurized.
Yeah.
So you have
it's
to.
just a supply mist on
Yeah.
Okay.
for soothing,
Yeah.
healing
Healing properties.
properties, but not.
It's not pressurized at all. You're laying on the bed. It fits around the head and the shoulders perfectly.
There's a gun that helps apply also topically.
Right.
With different ampules, with different vitamin, like
Maybe
methyl.
next week we can demo this. Maybe
But
we'll
this one
leave the
is,
table next week
when you
and we'll go into the treatment rooms and watch you guys doing or performing a treatment on someone.
Or
We can do
that
that.
during the week.
Things that
Yeah.
you do, yes, you,
I think
a
we
lot
should
of
do
time,
that.
The skin is compromised and we cannot physically touch it.
Right.
After procedure and laser, we don't want to manipulate the skin too much. This is a perfect addition. You just put them there and let them sit, relax, and kind of
And you
meditate.
feel like you're in a spa, in an oasis
Yeah.
when you're laying under
Her
the
room
oxygen.
is like that too.
You have to try it.
You have to.
Yes,
It's amazing.
Very nice.
So products. What do we say? We
Oh
go.
gosh.
There's so
Don't ask me.
There's
I'm
so
gonna take
many.
2 hours.
And we only carry what we love here.
Yes.
We don't have any products that we don't believe in, that we don't think are wonderful, that we don't think you'll enjoy. So maybe talk about a couple. What do you think? Does everybody have to use an eye cream?
It's, as long as you use something. I don't
Okay.
care how difficult your skincare routine is, but as long as you clean, hydrate, and protect.
Okay. I like that.
So-
Clean, hydrate, and protect.
This is great as an eye cream.
Yeah.
The dermal repair.
The dermal repair is really good.
Use-
And it's great because it's not a greasy product.
No, I actually use
Men
it
love
under my
this
line.
too.
Yes, it does. My husband
Spread
loves
that
it.
everywhere. You're
Yeah.
good.
If you're really dry, the Lemieux cream
Hydrating, super. It has a
really,
lot of hyaluronic
people love
in
that.
it.
The older patients, people that are super dry, men that are dry, they really enjoy that. This one won an award, right? This DNA
repair.
won a an award for repairing the skin after
Correct.
skin cancer. It actually helps protect you from skin
Does it
cancer.
also prevent, I guess, in a way? Or just protect?
Let me see. This is brand new to our
Not so much
office.
Preventing it's not going to the
It's-
sun. That's what it prevents you.
Right.
Or keep your hat on and.
This is
to.
to help prevent.
Yeah.
It does help prevent.
Mm-hmm.
But you would follow
UVA
this with a
and
moisturizer.
UVB.
You would follow this with a moisturizer.
It's moisturizing. Yeah, it's moisturizing for
Yeah.
me on its own, and then I follow with an SPF.
It
But
doesn't have SPF. You have
yeah,
to use it.
but remember UVA. If you want to remember
That's
how to
actually pretty.
know this, UVA is aging, damages, and UVB is burning. So they're two different. And maybe you could talk a little bit
UVC
about
is
that.
cancer.
Yeah, maybe you could talk about that, Dr. Iman, as far as aging and burning.
I just tell
because-
people, with regards to different SPF, you have a chemical defense and you have a physical defense. And using, I don't see it out here right now, but using some type of serum that has either a vitamin C or Floritin is a good product by SkinCeuticals.
Yes.
Floritin is like the Bentley of antioxidant serums, in my opinion. You put that on after you cleanse and tone, put that on, then you would follow it with other serums that you want to use. If it's, here it is.
Oh,
See
perfect.
if you're like Floritin, perfect.
I personally like this one. If for acne prone skin.
Yeah, it's all skin types. If you put it on and then just did your moisturizers and didn't follow it with an actual physical creamy SPF, you're still fine, but I always recommend both, especially in California. But let's say you forgot. If you have this on, you're fine. Like you're still good.
Yeah.
And this lasts a lot longer than a physical defense because it's penetrating deeper. It's protecting your skin cells on a molecular level versus just on a sheer outside physical defense. So, but I like all products. I tell everybody, I don't care what you use, as long as you're using something. So,
Except mineral oil.
except
gosh,
mineral
no.
oil.
Yeah. I hate mineral oil.
I love grapeseed oil though.
Oh,
Anybody
yeah.
who knows me knows that I
You
love
do
grapeseed
like
oil.
that.
Yeah.
I have to get
I
that.
really
So
haven't
good.
used grapeseed oil.
I have
You're
a
missing out.
I know, I'm probably missing out.
Yeah.
Well,
Yeah.
I should add
Take
that
a
into-
sample from my.
Oh, you have grapeseed oil? Yeah. She has grapeseed oil.
We have grapeseed oil.
She
Well,
has
who
grapeseed
knew?
oil.
You know our half hour is up.
Really?
Yes.
Yes. Oh, God.
I'm looking at the
for
time.
We didn't even talk about exfoliating.
Well, quickly talk about exfoliating.
Well,
You're
this is
brilliant at exfoliating.
well, this is a great
It
exfoliating
is a good
cleanser.
wash.
Lemieux.
It's a
in the
great
products,
wash.
but we
It's
have
a
a lot
great-
of
and it
wash.
smells good.
We talked about
Smells like
dermaplaning
oranges.
exfoliation. Clear and
Honestly,
brilliant.
I think everybody has their own. There's not any one size fits all regimen.
Absolutely.
Yeah.
If you come in and we look at your skin and we think that you're going to be a better candidate for Sente versus Neova, then we're going to put you on Sente. But we'll say, okay, well, I like dermal repair, but I also like this. So we mix and match. It's not one size fits all.
And it's kind of like your own personal regimen. Everything is customized to each patient's individual
Yes.
skin type.
Yeah.
So it's not like one product is preferred over the other. It's what's more effective for that patient,
Right.
that individual.
We have to go to work now. There's a
Okay,
patient that
there's
just
a
walked
patient.
in.
Well, hello
Thank
there.
you for joining us
Thank
at,
you.
at Brentwood Beauty Buzz at Advanced Skincare in Brentwood. Please join us next week. Send us your photos, pop in for a coffee. We're right in the heart of Brentwood, Advanced Skincare, and we'll see you next week. Let's put our little logo back up. We will see you next time. Thank you for coming by.
Thank